So the palpation of elbow joint. So basically the elbow joint palpation starts from the mid of the your arm. It is divided in different sections. First is your medial palpation, anterior palpation, lateral palpation and posterior palpation. So let's start with medial elbow palpation with arm. So first of all, again it start with the position of the patient or position of the client. Or your client or patient should be seated on a stool, and the therapist will position himself in front of the patient like this, and the elbow should remain little bit in flexion. It should be for making the all the muscles relax. Localization, it start from the mid of the arm or at the location of the shaft of the humerus. So first of all, identification of bony landmark. Basically, the bony landmark around the elbow joint is there are three different bony landmarks which we can identify very easily. One is your medial epicondyle. It is marked here. Second is the lateral epicondyle, which is on the lateral side of the elbow, and third is your olecranon, which is found at the posterior side of the elbow. So these are the three bony landmarks, and basically all these landmarks is used for localization, as well as these all landmarks have a start from the mid of the arm. First of all, you have to place your hand on the mid shaft region or just above of that. So I am just going to palpate the shaft of the humerus over here. It is a very loose area. See, the anterior group and posterior both can be separated from here, and I can identify the shaft of the humerus. So first of all, you have to perform a transverse palpatory technique, identify the shaft, then gradually slide your finger pad in downward direction and further identify the shaft, as well as you will proceed towards the downward direction or inferior direction. It is getting triangular because the lower half of the shaft of the humerus, it is about a triangular shape. In upper half it is cylindrical. So here you will find the bony consistency, but as well as you proceed in downward direction, gradually it change its shape and you can find the clear cut border of that triangle, means medial border of the shaft of the humerus. Slide your finger pad more inferiorly, and ultimately this triangular shape changes or it is become a well defined edge like structure because your distal humerus is broad. So it is converted in a edge like structure, that is your supracondylar ridge. So basically this is the location where we can identify clear cut border like structure, and it is the location of supracondylar ridge. What is the importance of this area? Basically, it provides the attachment of all flexor group of muscle. So first of all, is provide the attachment. This is already marked, but because muscle was in contracted state, so it is little bit downward. So here I can feel the muscular consistency, the first muscular consistency, which is because of the presence of your pronator teres. So the upper portion of the supracondylar ridge basically provide the attachment, that is your first muscle, which is your pronator teres. How to identify? Just instruct the subject to flex the elbow along with the pronation of the forearm. So I am just providing the resistance, and subject is trying to pronate and flex the elbow.
See, here I can find the margin of the pronator teres, lateral margin of pronator teres. The orientation of this muscle is like this, and basically this border or lateral edge of the pronator teres basically form the cubital fossa, medial boundary of the cubital fossa. Okay, so you can palpate the complete course of muscle by instructing the patient to perform the elbow flexion along with the pronation. Relax, and you further move, you will ultimately reach over a bony projection which is found around the joint line. See, this is the joint line. So just medial to the joint line, or if you follow the supracondylar ridge, so ultimately you will reach over the medial epicondyle. Again, this is the location from where the rest of the flexor group muscles originate, and in case of golfer elbow, this area is inflamed, or the common flexor group of muscle affected, and this condition is called the golfer elbow. Okay, so this is the clinical importance of this landmark. One, basically it provides the attachment to all the flexor group. Second, this landmark could be used for identification of other soft tissue landmark which passes through this area. One more landmark I would like to discuss over here. Just posterior to this location, we can identify the ulnar nerve. Basically, ulnar nerve passes just posterior to this bony landmark. So you can place your finger pad like this. Keep the elbow in little bit flexion. It should not be extended position. It should not be in flex position. If you keep the elbow in extended position, the muscle will remain in maximum relaxed state, and you will not be able, and this groove is more deeper. So the nerve will go inside and you will not be able to identify. If you keep the elbow in flex position, the muscle will get tight, and again you will not be able to identify it. So for that purpose, you should keep the elbow in a little bit flex position, and just slide your finger pad posteriorly to this landmark. Make a hook grip like this, and then try to hook that soft consistency landmark, that is your ulnar nerve. Okay, so this is the location, and in most of the pathological condition, even in case of dislocation, subluxation, or in case of fracture around the elbow joint, this nerve is affected. There are several conditions that could lead to the compression over this nerve. Now come to the next landmark, which is found basically anterior to the elbow joint, that is your tendon of biceps. Here I have already marked, this is the aponeurosis of your bicep, and this is the tendon of your bicep brachii. How to identify? Again, just instruct the subject to flex the elbow. See, now this tendon is getting prominent. Even I can hook around this tendon. See, my finger pad is posterior to this tendon. So this is the location of your bicep tendon. Basically, this tendon is again used for localization. You can identify it very easily. It doesn't matter what is the body build of the subject. Almost in all subjects, we can identify this very easily. The next landmark which is used, or which we can identify on the basis of this tendon, that is your neurovascular bundle, brachial artery and your median nerve. How to identify? Just bring your finger pad just adjacent to this tendon of biceps. Even this neurovascular structure is found beneath the tendon of biceps brachii. So I have to position my finger pad like this, or I can feel the knocking of the pulse just beneath my thumb pad. So this is the location of your brachial artery. If suppose in your subject the pulse is feeble and you are not able to identify it properly, so there is a tip that just apply little bit more pressure over here, and same time first identify the radial pulse, then apply more pressure over here, and if your location is right, so the radial pulse will disappear along with your pressure or compression. Just shift your finger pad little bit from that structure, means from the artery, and again apply further pressure and maintain it for prolonged period of time. If your location is right, if you are compressing the median nerve, then the sensory changes will appear soon in the distribution of your median nerve, means in your forearm or in your hand. So by this we can confirm the location of median nerve. So these are the two neurovascular structure which can be identified just posterior to the tendon of bicep tendon. Next muscle is basically your brachioradialis. Basically this is the muscle which is the part of the lateral palpation technique, but here I am going to discuss because it forms the cubital fossa. So here again you instruct the patient to flex the elbow along with the radial deviation of the wrist. Yes, flex. See, this muscle is getting prominent over here. So this is the location of your brachioradialis, and I have already marked the medial margin or medial border of this muscle. Basically the medial border of the brachioradialis form the cubital fossa, and this is a loose zone. Superiorly it is covered by your biceps. Laterally, medial border of the brachioradialis. Medially it is covered by the lateral border of the pronator teres, and this is the location of your cubital fossa.